Hello to all my friends. I am Dr. Avinash. I am a consultant pulmonologist at BGS Apollo Hospital, Mysuru. I would like to speak about obstructive sleep apnea, which is gaining prominence now because of the lifestyle changes that is happening because of the increase in the incidence of obesity. Obstructive sleep apnea, as the name suggests, is characterized by obstruction in your upper airways that happens during sleep, which is characterized by apneas. Apneas means stopping or cessation of breath which lasts for more than 10 seconds. In whom obstructive sleep apnea occurs? Obstructive sleep apnea is more commonly seen in people who are obese. Obesity is in the form of abdominal obesity or morbid obesity with BMI of more than 35 or more than 30. Second is neck circumference more than 40 centimeters, and in whom there are some amount of facial deformities in the form of a large tongue, retrognathia, or the jaw being slightly behind. In these instances, there are increased incidence of obstructive sleep apnea. The patient usually presents with loud snoring at night. They end up having frequent episodes, what we call as choking. Choking means cessation or absence of breaths followed by a sudden inspiration. Third, they end up having frequent daytime sleepiness. Fourth, they end up having fatigability during the daytimes. Fifth, they end up having unrefreshed sleep when they wake up in the morning. Diagnosis of obstructive sleep apnea occurs in the form of a sleep study. Sleep study are of two types. One is a diagnostic sleep study, another is a therapeutic sleep study. Diagnostic sleep study occurs either in a hospital or a home-based setting where we end up assessing multiple factors including EEG or electroencephalogram, electrocardiogram, along with that nasal airflow obstruction, association of snoring. There is also assessment of SpO2 or the pulse oximetry to look for oxygen saturation, your heart rate, and variation in all these parameters that happens during your cessation of sleep. Therapeutic sleep study happens when we end up doing a CPAP titration or continuous positive airway pressure titration in order to assess optimal airway pressures when your obstructive sleep apnea and your hypopneas are at the minimum as possible. Treatment of obstructive sleep apnea occurs in the form of sleep hygiene, and secondly in the form of utilization of a machine called as the CPAP machine or continuous positive airway pressure machine. Here the machine, what it does is it pumps air through your upper airways or through your nose or your mouth at a higher pressure, causing a splinting effect in your airways and thereby maintaining your airways from collapsing during sleep. Why is obstructive sleep apnea important? Obstructive sleep apnea is important because it is associated with number of other comorbidities like uncontrolled hypertension, uncontrolled diabetes, hypothyroidism, and it is associated with increase in weight gain, and all of this is associated with increased cardiovascular morbidity in the form of arrhythmias, in the form of heart attacks, in the form of stroke and other related changes. So optimal diagnosis and treatment of obstructive sleep apnea becomes very important in order to prevent these instances from occurring and for optimal control of your comorbid existing conditions. At Apollo Hospital, we have facilities for the diagnosis and the management of obstructive sleep apnea so that we can help you to sleep better. Thank you.